The Seoul High Court has rejected the medical community's efforts to block the government's plan to drastically boost medical school admissions. The ruling gave the government a major boost to push through the plan, paving the way for Korea's first medical student quota hike in 27 years. The presidential office said that this has, quote-unquote, concluded the spiraling controversy over the issue, urging striking doctors to return to hospitals. But they're showing no intention of heading back. The head of the Korea Medical Association even called the court's decision as the final death sentence that will ruin Korea's medical system. What's next for the medical student quota hike? For some clues, we have Song Se-ryun, professor of law at Kyung Hee University, joining us. It's always a great pleasure to have you with us.
My pleasure. Happy to join you.
We also have Dr. Alice Tan, an internist at MizMedi Women's Hospital, with us tonight. It's always great to see you.
Thank you for inviting me.
All right, let's kick things off with you, Professor Song. Let's first look into the details of this ruling. Could you explain for us the key points made by the court upon its delivery of the ruling?
Right. In this battle, doctors and students and various doctors groups filed an injunction lawsuit trying to block the implementation of the quota increase. But most of the suits were either dismissed or rejected, largely due to a standing ground. Standing means that only those people who are directly impacted by this action can sue. So if it's a quota issue, then the proper party to have a standing would be the medical school or the students. But the doctors groups, those parties that initiate this lawsuit, they are all knocked down. So there is a first hurdle of the standing, but the second hurdle, when it gets to the substantive part of it, in this stage, because it is a temporary injunction, we're trying to stop right away, the court is saying, well, we don't see clear reason to stop the proceeding of the government at this point. What can they do? They can go for a substantive, a second one, so to speak, or for not a temporary injunction, but the permanent injunction of the government actions. So those people who survive the standing program is preparing for that. But I got to say that this battle happening in the legal courtroom is not the proper ground. Because the courts would say that this is a policy issue, political issue, not exactly the legal issue. They look at the legal part of it, which is a small section of the whole question. So they'll look at the procedure or the process of it. But in terms of whether this policy is a good one or not, they're not the party. So they're not the proper authority to do it. So they'll exercise what is called a judicial restraint and defer the decisions mostly through the government. So I think the odds are stacked against the doctors, but from the get-go, the proper ground was not the courtroom, but in the political realm and the political and the policy negotiations and the collaborations that should have taken place, or which is sorely lacking in this case.
Nonetheless, Dr. Tan, many say that the ruling has posed a major setback to doctors' concerted efforts to stop the medical student hike, but striking trainee doctors are not backing down. They say they have no intention of returning to hospitals, while medical professors are looking to expand their weekly breaks and initiate a one-week suspension of medical services in protest as well. Tell us more about how doctors are responding to the ruling.
So first of all, there seems to be greater unity among the different doctor groups and members of the medical community. So there was a joint press conference of the Korean Society of Medical Education, the Korean Board of Medical Specialties, and the KMA, in which they really dissected the evidence that was presented to the court and showed very clearly that the deliberation process for coming up with this number of 2,000 for increasing the medical school quota was very, the basis was very weak. The evidence is very scant. And so that has been established, I think, just looking at the data as they were presented. And so now we are seeing greater unity among physician groups. As you said, medical students have not returned to the classrooms. Doctors in training have not budged. They have not returned to hospitals to work. And then, of course, the attending physicians at university level hospitals, they're really tired. They're fatigued because of all of the extra work that they're having to do. And so they are overhauling their work schedule so that they can balance patient safety with clinical care, their research responsibilities, and their own well-being. In terms of a larger strike, as of this afternoon, I understand that that has not been on the table. This is from the chairman of the KMA, that's not on the table yet, a general strike of 140,000 doctors around the country. But it is, we hope that we don't have to get to that stage. And as Professor Kim said, there is a solution. There's a very clear solution to this problem, and that is dialogue that is transparent, debate that is data-driven, and discussion that includes all of the key stakeholders so that we can come up with a policy that protects the health of the Korean people. That is our common goal, and we should act as partners in achieving this goal, not in a confrontational manner.
Doctors are making strong remarks about the ruling. The Korean Medical Student Association said the ruling clearly showed that Korea's legal principles have been collapsed by what they called the dictatorial government, while the KMA called the decision a death sentence, as I mentioned at the top, to Korea's medical system. It looks like the court's decision had little or no impact on them. Now, meanwhile, Professor Song, the presidential office has called on medical schools to expedite procedures to finalize enrollment expansion so it can be reflected from next year. What are the remaining legal procedures?
Well, as the policy stands, the last hurdle at this point is the universities have to amend their academic regulations to reflect the increase to quota, because without that, they cannot go ahead with it. So that would be something that the government is urging. Out of about 30 medical schools, there are some schools that have not gone through that. And they're looking to the Supreme Court and waiting for the final decision of this temporary loss injunction and also the permanent injunctions. So I think that there will be a little bit of delays because of those schools, but on the whole, the schedule will go through.
And while the government pushed to finalize medical schools quota expansion, Doctors Association appealed to the Supreme Court. As you mentioned, attorney Lee Byung-chul, representing doctors' side, expects the top court's decision to come as early as this month. What's the expected trajectory from here, and what are some possible variables going forward?
Again, going back to the whole thing about whether the courtroom is a proper venue to decide this thing. I think that I'm a little bit pessimistic about the substantive part of the lawsuit as well, because of the reasons that I talked about. Because this is a policy decisions, and the courts looking at this will only look at the procedural part of it and the process of it. It's the same thing as the court will not make a decision based on their business judgment when you're looking at the corporate cases. Likewise, they will not look at this as if they were taking over the government's role to decide what the policy is. So they'll confine themselves to the procedural and process part of it. So for that reason, even if the whole process has been bungled and not very well managed, the courts will look at it and say, well, let's see whether the modicum of the procedural legitimacy is there. And they find it, and they'll say that, well, we take it resolved. So I think that, as Dr. Dan said, this has to go back to the proper value, which is the political value. And I know that the doctors have been very resilient and very reluctant to change in the past. And there were attempts to increase the doctors' numbers and quotas, and it has not been successful. But maybe this is the time to just, take those things into consideration and sit down together and really go forward, looking at what kind of challenges, medical and social, that we're facing. I think that the key stakeholders has to be participating in this, and that process has been so limited.
And Dr. Tan, as the government-doctor standoff deepens, medical void is growing in hospitals. And as part of efforts to fill that void, the government has allowed foreign doctors to practice medicine at hospitals. Prime Minister Han Duck-soo assured the public that the government will take steps to ensure that only qualified foreign doctors can practice in Korea. What's your take on this?
I have a special perspective on this issue because I went to medical school here in Korea, but I did my residency training in the United States. And in order to go to the United States to do my training, I had to take a United States medical licensing examination, which consists of a series of 3 tests, basic science, and clinical skills assessment as well. Non-US citizens have to take a English language proficiency test. Our credentials need to be reviewed by the Educational Commission for Foreign Medical Graduates. It's a very involved process. Likewise, here in Korea, for foreign medical graduates, they have to take the Korean medical licensing examination, and they have to pass, like every other doctor, to practice medicine here in South Korea. It is shocking to hear a government official say that we would be breaking our well-established practices and laws regarding the practice of medicine in South Korea, which are in line with international standards and practices for medical licensing throughout the world. And to say that this would be done without establishing really clear criteria, what kind of testing would be done, it's very disappointing, and it's shocking. And I think Koreans should be shocked to hear something like this from a government official. They should be doing everything they can to protect the health of our people, including making sure that our doctors are well qualified, trained, and ready to practice medicine in our country.
Now, here's another point of discussion that's grabbing spotlight, Dr. Tan. The government is looking to establish a defense medical school where long-term service military doctors will be trained. Some 200 military doctors have been dispatched to fill medical void since doctors' walkout began, and it seems that the move is part of government efforts to enhance public health care services in national emergencies. What are your thoughts on this?
I think the concept of a defense medical school is just fine. There's nothing wrong with that as a concept. But I would like to remind the public of what happened in the recent past when the government decided to increase the number of doctors in the public health sphere by establishing a medical college at Seoul University. This was established in 1991, specifically to try to increase the number of medical school graduates in the public health sphere. And because of substandard education and continuous poor standing and performance in terms of trying to reach accreditation standards, the medical school had to close. And it was a huge fiasco. It was chaotic. There was financial loss. Medical school students, they felt like their futures were taken away from them. And so the decision to establish a medical college should not be made spontaneously or as a reactionary measure. It needs to be well thought out, and a long-term plan needs to be put in place. It shouldn't just be floated in this scenario to try to ease maybe the anxieties of the public. That's not the way to go about, because we have precedents of what happens when the government tries to approach it in this manner. It fails.
So you have your concerns about this, and what the government needs is a more long-term perspective, a long-term review on the matter, especially judging from the past. Now, moving on to what seems to be another big legal issue dividing the government and doctors. Professor Song, the government issued an ultimatum today that under the relevant law, junior doctors must return to their work sites within 3 months of departure to qualify for next year's fellowship exam. Today marks exactly 3 months since trainee doctors launched a nationwide strike, so this means the majority of striking doctors have until midnight to return to hospitals, but doctors argue otherwise. What's the accurate interpretation of related laws?
Well, there's a controversy. The rule says that in order to take the exam, we're talking about the residents, they have to go through the training from March to February, so 1 year period. But if for some reason they don't fulfill that period, they have another chance the next year for a 3 months period to make up for it. So that 3 months make-up period is the maximum that's allowable. That's what government is saying. Of course, there are exceptions. If you get sick, if there are some emergencies, they take off those periods. So the battle at this point is that government is looking at it very narrowly, and the residents are looking at it as very expansively and very permissively. So that's why there is a discrepancy. I think that the government, I think, has an upper hand because of they play the regulating role. And again, this is a kind of situation where the training doctors or the residents will probably be disadvantaged if they don't take the exam, if they don't come back. But ultimately, the ultimate loser could be the government, because the government is causing a very, very big public health crisis without solving it for months after months.
Well, concerns are rising that in worst case scenario, Korea will have nearly 3,000 less specialists next year because of this, which could significantly impact the country's medical services. It looks like a dialogue, as Dr. Tan has mentioned, is needed now more than ever between the government and doctors, which is why the government repeated its calls on doctors to engage in dialogue, saying it's ready to talk at any time with no restrictions on the form or agenda. But Dr. Tan, it looks like doctors won't respond to the government's calls for dialogue. What more efforts are needed at this stage to strike up a conversation between the two sides and ultimately to find a breakthrough to end the prolonged medical deadlock?
I think we really need to focus on what the true threats to healthcare are in South Korea. We don't need to create conflict. We have enough problems and challenges to deal with as it stands. For example, the Korean national health insurance system may become bankrupt in the near future. We are behind in trying to adapt to a low birth rate and reverse pyramid demographic social structure. We need to work together, the government and healthcare professionals, in trying to find healthcare reform that everyone can live with. The key stakeholders need to be involved and represented in these discussions. The discussions need to be transparent. And I should note, in 2024, for residency positions, there was actually a surplus of doctors relative to the number of residency positions. In other words, even though there were 222 doctors who could not get residency positions of their choice, there were still positions in the field of obstetrics and gynecology, pediatrics, family medicine that went completely unfilled. There are many university programs that have no residents in these fields. And so we need to examine why. Why is this trend occurring? And that's what we need to focus on, and that's what we need to try to fix. I think we're really wasting a lot of time, we're wasting a lot of resources, and animosity is only growing, and that's not the way to solve this problem. We need to come together in dialogue, and I would stress that doctors have asked for being at the table from the beginning. In other words, starting from scratch, going back to the drawing board to come up with a policy that truly works, and having the true experts in medical education, healthcare administration, doctors who are clinicians on the front line. We know what our patients need. We know what the public needs in terms of healthcare, and we would like to have our voices heard from the beginning when the discussions are just being started in terms of what to do with healthcare reform. We don't want someone to try to force policies down our throat that we are afraid will ultimately harm the Korean people and also lead to substandard education, which has happened in the past when measures were taken that were too hastily put together.
Well, unfortunately, no immediate breakthrough is in sight unless major concessions are made by either side, but we'll be sure to watch closely how things develop from this point on. Thank you so much, Dr. Tan and Professor Song, as always, for sharing your thoughts.
Thank you.
Pleasure. Thank you.
And that brings us to the end of the show. Thank you for watching, and be sure to tune in same time tomorrow to join our conversation. Goodbye for now.